Now to the public health crisis over deaths from toxic illicit drugs. Preliminary results from the BC Coroners Service show there were more than 2,200 toxic drug deaths in that province in 2022, the second deadliest year on record. That's just 34 fewer than the 2,306 deaths reported in 2021. It amounts to an average of 189 people dying every month in 2022, and that means about 6 people dying every day. The number of lives lost is hard to comprehend. BC is starting a pilot project that decriminalizes possession of small amounts of certain illicit drugs. It's hoped it will help save lives. Neetu Garcha breaks down the grim facts of BC's drug crisis.
A toxic supply of drugs remains the leading cause of unnatural deaths in BC, significantly more than car crashes, self-harm and homicides combined, according to BC's chief coroner, releasing another tragic set of numbers of fatalities right across the province.
3 of the 5 health authorities experienced their highest rates of death ever in 2022.
More than 11,000 people have died in BC since the declaration of a drug toxicity public health emergency in April of 2016. 70% of those dying are aged 30 to 59, but she says children and youth are being significantly impacted.
Both in experiencing harms from using substances themselves, but also in suffering the loss of siblings, parents, grandparents, and caregivers.
All right, love you.
First Nations continue to be the hardest hit population, with more dying from toxic drugs than from COVID-19, according to the First Nations Health Authority.
Seeking treatment alone in the standard Western format may not meet the needs of all First Nations people.
For all who are at risk, some say treatment options must include a safe supply of drugs.
We currently do not have youth-dedicated overdose prevention sites, as well as supervised injection facilities across this province.
Cities with some of the highest numbers of deaths in 2022 were Vancouver, Surrey, and Greater Victoria, where there's also a high concentration of international students. Some have been sounding the alarm about toxic illicit drug deaths among their peer groups.
So the post-secondary institutions and like private colleges, they are using students as a cash cow, but don't deliver multilingual mental health and harm reduction supports within colleges and universities. I think this should be mandated by the provincial governments.
All this comes as BC decriminalizes small amounts of hard drugs in a move to stem the seemingly unstoppable trend of toxic drug deaths. Neetu Garcha, Global News, Vancouver.
Across this country, there were more than 3,500 opioid toxicity deaths from January to June of last year. BC factored in illicit drugs, but not every province tracks the same data. And when it comes to opioids, the majority of deaths occurred in BC, Ontario, and Alberta. 97% of deaths were accidental.